In this presentation, I'm going to talk about how the temperature rises and falls during laser or IPL irradiation of a target in the dermis. This follows a presentation we did previously on light going into the skin. So imagine there's a target in the dermis somewhere, and we fire a pulse of laser or IPL energy. Some of that energy will be absorbed by the target, causing its temperature to increase. Now the dermis is full of water, and water is actually quite a good conductor of heat energy. So some of that heat which was generated in the target will conduct outwards into the dermis during the pulse. Conduction will continue after the pulse, which will result in the target becoming cooler over time, whereas the surrounding dermis will begin to increase in temperature. So as a consequence of conduction both during and after the pulse, we find that the peak temperature in the target tends to be higher during shorter pulses, where we have less conduction during the pulse, and lower during and after long pulses because of more conduction. This is important because this helps to focus our minds on the choice of pulse width when treating particular targets. So the temperature increase in the target depends on a number of factors. This includes the amount of energy that's absorbed by that target. The mass of the target is very important. Its density and specific heat capacity are also important factors. And then the pulse width, because as we can see, the long pulse widths will generate lower temperatures compared to shorter pulse widths. And also the delay between subpulses. All IPL systems and some lasers will generate a train of pulses. And the gap between the subpulses, if it's too long, then you're going to get too much cooling during those overall pulses. So shortening the subpulse gap is actually very important. We discuss this more in our book. And tissue denaturation, so this is actual breakdown of cells and the structure of cells. This really depends on the temperature and the time. It's a combination. Merely achieving a certain temperature is not sufficient. You have to achieve a temperature and maintain that temperature for a particular time to achieve the end goal. So let's compare short and long pulses and just see what happens to the temperature profile. For a short pulse, we get a fairly spiky temperature profile like this. So we can achieve a relatively high peak temperature during the pulse, or by the end of the pulse even. And this is because there's little conduction during the pulse, so most of the heat energy is retained within the target, thereby generating a decent temperature. But if we then apply a longer pulse to the same target with the same energy, then what will happen is that there's more time for the heat energy to conduct away during the pulse, and therefore we will get a lower peak temperature as a result. So that's a brief introduction into the thermodynamics of targets within the skin. It's very important to understand how the temperature increases and decreases both during and after pulses. And this is not just for photothermal treatments, but also for photomechanical treatments, such as tattoo removal with Q-switched and picosecond lasers. A good understanding of this sort of stuff will definitely help you to choose better parameters for your treatments. You can find more information at our blog, or there are more of these little animations on our YouTube channel at Laser-IPL Guys. Thanks for listening.